Welcome back to the final episode of the Medical Weight Loss Show for 2024. I'm your host, Dr. Andrea Walker, weight loss specialist, nurse practitioner, and your guide through the world of weight loss and wellness. As we close out 2024, I want to take a deep dive into one of the most transformative tools in weight loss medicine, GLP-1 meds. Let's reflect on how these medications have shaped the weight loss journey this year and what we can expect as we head into 2025. So grab a cozy cup of hot tea, find a comfy spot, and let's dive into today's topic, a recap of GLP-1 drugs throughout 2024. We've seen so much progress and discussion this year, so stay tuned as we explore the latest developments, breakthroughs, and what's next in the world of GLP-1 medications. So let's get started. GLP-1 medications have continued to dominate the weight loss landscape in 2024. From semaglutide, marketed as Ozempic and Wegovy, to tirzepatide, also known as Mounjaro and Zepbound, these treatments have redefined what's possible for many patients struggling with weight loss. Many have considered them to be miracle drugs. To recap, GLP-1 medications work by mimicking the action of the glucagon-like peptide 1 hormone, which helps regulate appetite and blood sugar levels. This not only reduces hunger, but also leads to sustainable weight loss for many patients. So, here's some key trends from 2024. There was increase in availability due to the FDA allowing compounded pharmacies to compound semaglutide and tirzepatide. The GLP-1 medications gained even more popularity among patients. However, there were challenges with supply and demand, mainly with the brand versions of the GLP-1 meds, to the point some patients faced delays in obtaining their medications, which is why many did turn to compounding pharmacies. And then there was expanded insurance coverage for some, though affordability continues to remain an issue for many. And then there were many research breakthroughs, including new data on long term benefits and expanded indications for use. GLP-1 medications were initially developed for type 2 diabetes management, but have been extensively researched in 2024 for various additional therapeutic applications. Notable findings include neurodegenerative diseases. Studies suggest that GLP-1 medications may offer neuroprotective effects, potentially reducing the risk of Alzheimer's disease by protecting brain cells and improving cognitive function. And then non alcoholic fatty liver disease. Research indicates that GLP-1 drugs can improve liver function and reduce fat accumulation in the liver, making them a promising treatment for this condition. Next is polycystic ovary syndrome. GLP-1 medications have been found to enhance insulin sensitivity and regulate ovulation in women with PCOS, offering a potential therapeutic option for this condition. And then psychiatric disorders. Preliminary studies are exploring the impact of GLP-1 drugs on mood disorders and cognitive functions on mental health. And then there's chronic kidney disease. Research is assessing the benefits of GLP-1 medications in slowing the progression of kidney disease and improving renal functions in patients with CKD. And of course, we all know about the cardiovascular disease benefits. GLP-1 agonists have demonstrated cardioprotective effects, reducing the risk of heart attacks and strokes in patients with cardiovascular conditions. And then substance use disorders. GLP-1 agonists are under development for substance use disorders, showing potential in reducing the self administered intake of drugs and alcohol in non human animals, though human studies are ongoing. And then there's binge eating disorder. These medications are being investigated for treating binge eating disorders as they can reduce obsessive thoughts about food and binging urges. And then cancer risk reduction. Retrospective studies have associated GLP-1 exposure with lower risk of specific types of obesity-associated cancers compared with insulin or metformin in patients with type 2 diabetes. And a few other diagnoses, such as sleep apnea and certain types of arthritis, are currently being investigated, for improvement with the use of GLP-1 meds. While these findings are promising, it's essential to consult healthcare professionals before considering GLP-1 medications for off label uses, as further research is ongoing to fully understand their efficacy and safety in these areas. Now, let's move on. This year, I've worked with patients who've achieved remarkable results. Weight loss of 15 to 25% of their body weight isn't uncommon with these medications when paired with lifestyle changes like healthy eating and regular physical activity. However, it hasn't been without challenges. Some patients experience side effects such as nausea or constipation, and others struggled with the out of pocket costs. But for the most part, it was well worth the benefits to my patients. Now, let's transition to reflections on newer medications and alternatives in 2025. In 2024, we saw the rise of newer formulations and delivery methods. These were all from compounding pharmacies. They included oral GLP-1 meds, sublingual, which means you place it on or under your tongue to dissolve, as well as GLP-1 sprays. Many of the compounding pharmacies also added B12, B6, or some other type of beneficial supplement to the GLP-1 meds. Tirzepatide's dual mechanism of action continues to impress with its combined GLP-1 and GIP effects. Meanwhile, semaglutide still had its place for users as well. For those unable to access the newer medications, such as semaglutide and tirzepatide, older options like liraglutide, which is also known as Saxenda, still played a role. While it may require daily injections compared to the weekly dosing of newer options, it remains a valuable tool, particularly for those with insurance coverage challenges. However, more compounding pharmacies are starting to offer liraglutide. Liraglutide was actually the first GLP-1 medication designed specifically for weight loss. So, what's on the horizon for GLP-1 medications in 2025? The research pipeline is buzzing with excitement. We're looking at even more effective combinations and potentially longer acting formulations that could simplify treatment further. As many have recently heard, the U.S. Food and Drug Administration, known as the FDA, has announced that the shortage of tirzepatide injections, known commercially as Mounjaro and Zepbound, has been resolved. Now, let me explain what that means. The reason that compounding pharmacies can actually compound tirzepatide and semaglutide is because it is known to be a quote shortage, which means that if I were to write a prescription for Mounjaro or Zepbound and send it to, let's say, your local pharmacy, Walmart or Walgreens, it would be a good chance that they may not have your particular dose in stock. In some places in the United States, you can't even find it within a probably 20-mile radius of a specific particular dose in stock. So that's what a shortage means. It just depends on where you live, what pharmacy you go to. Some places there's not a shortage, but some places there are. But what the FDA is saying is that now there is no longer a shortage. And if I were to write this prescription for you, there is a great chance that you will actually be able to pick it up at your pharmacy without any issues, without having to wait, weeks or months for the medication. I'm going to leave that right there. That may or may not be the case, but according to the FDA, there is no longer a shortage. So, consequently, the FDA has set deadlines for compounding pharmacies to cease the production and distribution of compounded tirzepatide. Compounding pharmacies that are considered 503A must stop compounding, distributing, or dispensing tirzepatide injections by February 18, 2025. And then compounding pharmacies, which are considered 503B, they have until March 19, 2025 to comply. These grace periods are intended to allow patients and healthcare providers time to transition to FDA-approved products without disrupting treatment or to find alternative compounded GLP-1 solutions for those whose insurance is still not going to cover the medications. Personally, I have shared this information with my patients who are on compounded tirzepatide. However, we will see what happens on or before February 18th, 2025, because I don't think the shortage is quite over. Many healthcare providers, including myself, do prescribe the brand versions of tirzepatide, which is known as Zepbound or Mounjaro, and patients still cannot get it filled at their local pharmacy. Or they do not want to pay over $1,000 per month because their insurance does not cover it. However, time will tell. But for now, after these dates, obtaining compounded tirzepatide will no longer be permissible under FDA regulations. Now, let's discuss possible new GLP-1 drugs that will hopefully be available within the next year or so. Retatrutide is an investigational drug developed by Eli Lilly, which are the same makers of Zepbound and Mounjaro. It is currently undergoing clinical trials for the treatment of obesity and related metabolic conditions. It functions as a triple hormone receptor agonist, targeting GLP-1, GIP, and glucagon receptors to regulate appetite, blood sugar, and fat metabolism. Here's some clinical trial progress of retatrutide. Phase 2 results. This was published in June of 2023. These results demonstrated that retatrutide achieved up to 17.5% mean weight reduction at 24 weeks in adults with obesity or overweight without diabetes. By 48 weeks, the mean weight reduction reached up to 24.2%. The treatment was generally well tolerated, with GI side effects being the most commonly reported. Retatrutide is currently in phase 3 clinical trials, which began in August 2023. Eli Lilly has initiated the Triumph Phase 3 clinical program to further investigate retatrutide for chronic weight management, obstructive sleep apnea, and knee osteoarthritis in individuals with obesity and overweight. As of December 2024, the drug has not yet received FDA approval. I know that many are already taking some form of retatrutide. One thing I can tell you is that you will not be able to purchase retatrutide from a licensed healthcare professional until it receives FDA approval. The FDA has issued warnings about the illegal sale of unapproved containing compounds like retatrutide labeled for research purposes but sold directly to consumers. This is why compounding medications get a bad rep. When you get your compounding medication from a compounding pharmacy, you're more than likely going to be okay. However, many go the underground route and they get these medications that haven't been FDA approved and they're still being investigated by the actual makers. So just keep in mind, if you are getting the underground form of the retatrutide, you're doing that with a lot of risk. These products are of unknown quality and may pose health risk. Consumers are advised not to purchase or use such unapproved medications. Now, on a positive note, retatrutide shows promise as a multifaceted treatment for obesity with potential benefits extending to liver health and cardiovascular risk reduction. However, it remains under clinical investigation and its safety and efficacy have not been fully established. Individuals, as previously stated, should avoid unapproved versions of the drug and consult healthcare professionals for guidance on approved weight management therapies. Now, here's a final thought and takeaway. The future landscape of weight loss medications is diverse, focusing on multiple physiological pathways to achieve and maintain weight reduction. Ongoing research aims to enhance efficacy, safety, and patient adherence, offering hope for more effective obesity treatments. As we wrap up this year, I want to emphasize that GLP-1 medications are powerful tools, but they're just one part of the weight loss equation. Sustainable success requires a holistic approach that includes healthy eating, exercise, and the right mindset. If you're considering GLP-1 medications or are currently using them, stay informed, communicate with your healthcare provider, and focus on long-term health. Thank you for joining me this year on the Medical Weight Loss Show. It's been an incredible journey discussing the science, strategies, and stories behind the weight loss. I'll see you in 2025 with more insights and inspiration to help you achieve your goals. Until then, take care and stay well. If you've enjoyed this episode, please take a moment to like, rate, and review the show. Your support helps us reach more listeners and continue bringing you valuable content. Don't forget to subscribe so you never miss an update. Thanks for tuning in, and we'll see you next time. Happy New Year, and here's to a healthier 2025.